Hello, it's Dr. Beth Colby from Talk Mental Health YouTube channel. Following my video last week on BC News Mental Health newspaper roundup and also my videos on anxiety and generalised anxiety disorder, I'm going to talk to you today about panic attacks. Did you know that women are twice as likely as men to suffer from panic attacks, and that 20% of Americans are likely to suffer a panic attack at least once in their lifetime? So what is a panic attack? A panic attack is a sudden feeling of intense anxiety or overwhelming fear. It is accompanied by other psychological and physical symptoms. It can lead to a person escaping from the situation they're in, and the fear that they experience is totally out of proportion to what they perceive as a threat. The physical symptoms of panic attacks are those of extreme anxiety. People can have palpitations, that's their heart racing fast, breathing fast. They can feel sick, dizzy, sweat, have tingling or numbness in their hands. They can have feeling sick and their stomach churning. They can have a dry mouth, feel like they're choking. They can tremble and have chest pain. With this go psychological symptoms of distress and anxiety. These include an overwhelming feeling of impending doom, terror, that something dreadful is going to happen, that they might have a heart attack or die, or go crazy and lose control. Most panic attacks last a few minutes, but they can last as little as 1 minute or more than an hour. The thinking and worry about having another panic attack can lead to a vicious cycle. So for instance, if somebody feels worried about something, they may get some physical symptoms, and then they may concentrate on these physical symptoms thinking, I'm going to have a panic attack, and get more and more anxious, and then the adrenaline goes around the body, leading to more and more fear, and eventually people can't contain their fear and anxiety, and it leads to a full-blown panic attack. This can also lead to avoidance. So say, for instance, somebody has a panic attack while they're on a bus. The next time they go to walk towards a bus stop or get on a bus, they may worry that they're going to have a panic attack, so they start to get physical symptoms of anxiety, and then they may avoid going to the bus stop or getting on a bus. And when they do that, the anxiety lessens, and this will reinforce the feeling that going on the bus is a dangerous situation. Some people may have panic attacks daily, others may have it once a month. The avoidance that the panic attacks may cause lead to somebody functioning less and becoming more isolated. Now, before I go on to talk about what to do if you have a panic attack, just remember that all these physical symptoms could be symptoms of other diseases. So if you are concerned, please see your doctor. Remember, if you're worried that you might have a panic attack, please remember the facts, that panic attacks aren't dangerous and you're not going to come to any physical harm from them. Okay, so you're beginning to feel as though you're going to get a panic attack or you're in a panic attack. What should you do? First of all, try to remain calm. I know that's easier said than done. Try to breathe deeply and slowly. What happens in a panic attack when people hyperventilate or breathe too fast is that they breathe out too much carbon dioxide, and that can lead to feeling faint and having tingling in the fingers. Some people find that using a brown paper bag and blowing in and out of it helps because they rebreathe their carbon dioxide. However, I don't know of anybody who has a paper bag to hand. If you're having a panic attack, try to stay where you are and not avoid that situation, which may, or run out away from it, because that may continue on the cycle of panic attacks. Remind yourself that this panic attack will pass. Do not fight the panic attack. Try and focus on peaceful, relaxing, calm situations. and remember that the panic attack is not life-threatening. If panic attacks are related to one particular situation, say a rat, then somebody would be diagnosed as having a phobic disorder. If somebody has panic attacks which leads them to not wanting to go outside, then they will be diagnosed with agoraphobia with panic attacks. And if they have panic attacks which aren't related to any situation, they'll be diagnosed with panic disorder. My next talk will be on panic disorder. Please like, subscribe, and make comments. That's it for now. Bye-bye.